Hey, y'all. So I've gotten some questions about the apps for anatomy that I was using in the office hours the other day. Um, so I'm just going to do a little walkthrough of some of the options. Most of the apps I have, you can see, are by this company, 3D4 Medical. And the one that I used in the office hours was this one, the Essential Anatomy 5. And as you can see, it starts off with the skeleton, and I can move the skeleton by moving my finger, sliding and gliding. I can tip it up. We can get all kinds of 3D views here. And then it's possible with the buttons over on the right to add the skin or remove the skin, add layers of muscle or remove them, add the arteries, including the heart, add the veins, and I can add the nervous system in. And I can also change the gender of this person. Going over to the left here, you can see, whoa, you can see I have this button down here that right now is indicating male. I can change it to female, and you'll notice the changes in the pelvis, right? Those are the most obvious changes are in the shape and height of the pelvis. Um, as you add and remove layers, all of those will shift as you move the skelly person, and you can also zoom in very much and zoom out as you like. You can zoom into the neck and check out what's going in the posterior neck and add more layers, getting into the, looks like the, if I tap it, it gives me the name serratus posterior superior, which looks like the rhomboids, right? But these are deep to the rhomboids. And then I can also tap and get information, the origin, insertion, action, and innervation of the muscle and arterial supply. Look at that. Lots of good info. But we can add all those layers all the way out to the most superficial layers. And then, adding systems on top of this, I can add what would be a system we could see it. If I add the lymphatic system, we'll be able to see the superficial lymphatics. I can add the digestive system, but that doesn't give us anything we can see until I peel away some layers of muscle. And then we can see deep to the abdominal muscles. I've got some guts in down there. I can remove the greater omentum by hiding it or fading it. I'll fade it first and then hide it. And then we can see all the stuff that we usually see in our anatomy books behind the greater omentum. So that's one app. It's pretty cool. There also are a bunch of apps that have more specialization. For example, I can go to the spine app, and I'm going to turn this vertically on my iPad. And with the spine app, same thing. I can add layers. I'm going to add in the nervous system there, and then add in the discs and the connective tissue. If we zoom in on one vertebral area, you can see how I'm adding in the connective tissue at the joint surfaces. These are on the joints for the ribs, and then the facet joints in between the vertebrae. You can see how those get added in with the discs. I can also take a section of the spine and look down from the top if I want, or I can zoom out and cut the whole thing in half and then add sections. So here we see the spinal cord inside the vertebrae. This is anterior, this is posterior. These are the spinous processes that you feel. And you can add layers if you want. There's the discs coming in, and then there's adding ligaments. And as we bring it back together, you can see the ligaments added on. These specialized ones also have some video included. So we can look at degenerative disc disease in the lumbar spine, and it's going to give a little description, but then show a visualization for the nucleus in the center of the disc and how it can wear through these layers of cartilage, eventually losing the fluid, the water basically that's in the center of the disc, losing the water out, and also losing the disc height so that bone starts to run into bone, and it's going to respond by creating bone spurs. We have a disc bulge happening in the back. The bone spurs are going to happen along here any second. There we go, bone spurs forming. Ow, ow, ow. So in each of these apps, they'll have, like, we have a herniated disc, we have ligament sprains, et cetera, et cetera. And if we go to a joint like the hip, it's going to do the same things, just focusing on the left hip. And as I remove layers, we'll see the musculature, the nerves. We can see the start of the sciatic nerve here. And if we take the posterior view and peel away some layers, oh, look, there's the sciatic nerve coming through the backside, our piriformis muscle. Now, it doesn't show the variations that happen with the sciatic nerve. Like sometimes this nerve comes half on top and half below. Sometimes part or all the nerve will come right through the belly of the muscle. So it doesn't show those kind of variations. You have to go to a more detailed kinesiological text for that. Haven't seen them in an app yet. And we also have videos in here. For example, doing a joint replacement, a hip replacement. It'll take us through the process. Now, this white surface, the white surfaces are the articular cartilage, and it's showing how the articular cartilage is wearing down. And that's bone on bone. That's going to cause a lot of pain. It's going to cause bone spurs to form. You can see the bone spurs. And so they just lop it up and zzz, take that out. This is all happening very quickly, and we are spared the sound effects and the smells. They put a little super glue in there, and then into the femur and attaching the ball, and then putting with more super glue, putting a new socket in on the pelvic side and drilling it in as well as the glue, and then the new inner cup for the socket. So we get an idea of the process of a hip replacement. That's the hip. We also have the shoulder. Does the same sort of things, goes through many of the different structures specifically related to the shoulder, doesn't connect it with the rest of the body. That's part of why I like that first app a lot, because you can see how some of the low back muscles, in particular the latissimus dorsi, it starts in the low back, but it's considered a shoulder muscle. One that's just on the skeleton. And this one, the orthopedic patient education, this is not one I'd recommend for most yoga teachers because it goes in to a lot of the pathology. Now, if you're a PT, this is bomb, I think. It goes into a lot of really specific anatomy. This is going to show the cruciate ligament, the crossing ligaments of the knee. Really nice graphics, right? A lot more detail than you get, and then showing it in flexion. So this one to me is a little over detailed for most yoga teachers, I think. But you know, I also know that there are yoga teachers who are really deeply dedicated into the Anatomy Nerd Tribe, and you feel the power. You do you. If this is what floats your boat, you can work your way into it. I think this is one of the more expensive ones. I can't look up the prices anymore because I own most of their apps. Some of their apps are like $5. Some of their apps are $15. And then some are like that last one, I think is more like $50. It used to be. I don't know if it's still that price. But that gives you an idea. That's one place to look for beautiful anatomical images that can be helpful when you're working for your own knowledge as a teacher, but also when you're working with clients who are living with injuries. And one thing I do with those apps with clients is I translate. That's part of my job as a teacher, and teaching yoga anatomy, but also teaching with clients, is that sometimes I will translate their report into English, because a lot of times they don't quite, understanding that there's a 4 millimeter bulge at L5S1, that isn't exactly clear, but I can show where that is. I can show approximately how big that is. I can show where the nerve roots are. And it's helpful, usually helpful. Okay, I hope that was helpful. This was helpful, and look forward to seeing y'all again. Thank you so much.